So the really cool thing about this clinic is that it's patient-centered. So what would happen is our patients come in, they are coming in because they're going to have a fine needle aspiration biopsy, and usually it's to diagnose whether they have a cancerous growth or not. So that in and of itself is very, very stressful for the patients.
One of the big challenges that we were having as surgeons was getting a diagnostic fine needle aspirate or a biopsy done in our patients in a timely fashion. So at that time, we had some close collaborations with other pathologists, but they were getting so busy and radiology part was so busy, our patients were waiting 1 or 2 months just to get a simple needle biopsy done. And that was a real challenge for us. So that's really the first step for many of our patients, is that they need to get that needle biopsy. That tells us kind of what we're dealing with, and then we can develop more workup from there. So having that delayed was a real challenge from a patient perspective, because you can imagine a patient shows up in your clinic, they have a surgeon tell them, yeah, you have a lump in your neck and I'm concerned about this. We now need to send that for a biopsy. Oh, by the way, it's going to be 2 months. Well, that's 2 months of very uncomfortable period for that patient. So they're obviously very concerned about this, often rightly so, they're concerned about that. And so we wanted to find a way to improve that process.
It was actually quite surprising when I came here. I wasn't expecting to actually get the results within 5 minutes of meeting Dr. Girgis. He explained everything was going to happen to me. He said, do you know what's happening to you and what will happen? And I said, I have some idea, but I don't know much. Like, he was very clear of what he was going to do, and he made me feel very comfortable. But the best part was after it was all said and done, he removed the needle and he just went to his microscope, which was like right beside him. And then he said, do you want to see this? And I said, I would love to see this. And I was so happy to actually get to see what was growing in my neck. He just made me feel so comfortable, and he gave me a positive outlook. He assured me that you're in good hands at this clinic, and I felt very relieved to hear that.
They come in, they can share their story directly with the persons that are actually going to be at the end of the day interpreting their biopsy. To me, that makes me a much better pathologist, seeing the patient, understanding their issues, seeing the tumor, if you will, and then eventually doing the biopsy and being able to assess it right away, and then deciding if this particular biopsy is sufficient or I need to do something else. So in other words, I'll be able to really get a very adequate diagnostic biopsy from the first time. Sometimes the cancer starts very little, very small lump, and if you can catch it early on when it's really not palpable, then you're definitely doing the patient a much great favor or benefit, because then it can be treated much faster.
I'm very satisfied with the care, and I'm pleased with the fact that we can really greatly improve the patient experience as we go through. And really, for me, it's really from a patient perspective. So I've had family members in the circumstance, friends who have had these delays to care, and it's probably the most stressful thing that they go through. For us to be able to put something together where we can relieve that stress for patients, I think is something that we're very happy about.
The patients can call me if they have any concerns. Just kind of ease their mind a bit, because it is a little bit scary. You're going for a biopsy. They're worried about what's going on, the symptoms they're having. Let them know that Dr. Girgis is so comforting. They're going to be so comfortable with him. And every time they come out of the room after their biopsy, they're just so grateful and thankful that you've called them and put them at ease.
Patient-centered care is important, and I felt everything was set up for what I needed, not come, have an ultrasound, go a week later, get on a wait list for a surgeon, wait 2 to 6 months maybe, and then I go in and see this person who said, oh, you don't really need my services, I might have to go to this expert, get on their wait list, and then make my way trickle down to where the person who I needed, I could be seen by. So this was immediately identified, sent into the clinic, the biopsy done and known within 72 hours.
What really opened my eyes into direct pathologist-patient interaction is when I started my fellowship training in the United States, and that was the first time that I realized that pathologists can actually be directly interacting with patients and collecting the clinical information, but also doing the biopsies and finally interpreting the biopsy. To me, this makes it way more relevant and way more inclusive, because then all the pieces are there. You'll be able to collect the history, you'll be able to check the imaging of the particular target, and then finally you do the biopsy, and then eventually you will interpret the results. So that makes it much more inclusive and much more relevant.
The transparency and the speed, like so efficient to have everything in one building. Like I just have to come here to do everything. Like basically meet with the doctor, the surgeon, meet with the pathologist. It's all in the same building, and it's just such a well integrated system here. And it's just more convenient that it's at the same location. That makes it even more efficient.
The fact that we can make a real difference in real time. When you see a patient leave here with a smile on their face bigger than anything, and you know that they don't have to wait for 8 to 10 days now for their results, that's huge.